Hi, welcome everyone. First skin school in 2021. Wow, I'm very excited because today I have an amazing guest who speaks pretty much the same language like me. That's why we're getting along so well, and we have so much to talk about. So I'm very happy to introduce you to Dr. Will Cole, who loves to see his patients the most healthy they can be. So he's into functional medicine, which I really much agree. And we're all agreeing to the same idea that we want to stay as healthy as possible, as strong as possible when we have to withstand so many stresses from outside. Welcome, Dr. Will Cole. Thank you for being here today.
Hi, friend. How are you doing?
Very well. Thank you for joining today. That's amazing.
I'm doing great. Thank you too. I'm excited about that we're talking today. I think people will really get a lot out of it.
Yes, I think there's a lot of interest in what can we do best in our homes or when we just with our family, and what can we do best to prevent from getting sick. Because I think the modern patient is really the patient who's sick, who's healthy, not sick. So we don't really want to get to this point where we have to go to see the doctor. We want to go and see the doctor maybe to prevent from, all the stressors and prevent from getting sick. So I think that's a very modern way of looking at a patient. And you have your clinic in Pittsburgh. And what do you do with your patients? What do you talk to them about? How do you recommend? What lab work do you do? Because you're also an anti-inflammatory doctor, like myself. And that's something we really pay a lot of attention to. So do you want to explain a little bit the process?
Yeah,
And
sure.
what you recommend to your patients?
Yeah. So I am a functional medicine practitioner. We started one of the first functional medicine telehealth centers in the world. So my whole career, over the past decade, we've been consulting people via webcam like we're talking right now. Normally it's one-on-one private consults, but we drop ship labs to them and really give them a thoughtful functional medicine approach to why they feel the way that they do. And I mean, you know this and you teach this so brilliantly. And I think there's so much synergy amongst our message and what we're trying to educate people on. It's that inflammation exists on a spectrum. So most people think they think of inflammation maybe as just severe arthritis or severe, maybe swollen in their body. It's not always that. So there's this larger inflammation spectrum from low-grade symptoms that are these check engine lights that we should start paying attention then. And then the severe things, of course, are on the other end of that spectrum. And then there's everything in between. But my heart and my passion are really people struggling with different inflammatory problems and giving them the tools to overcome them. Because while we see rising numbers of different health issues, if you look at autoimmune problems alone, I mean, it's estimated that 50 million Americans have an autoimmune disease. About 250 million people around the world have an autoimmune disease. That's just the diagnosable ones.
But it's increasing, no?
It's increasing, absolutely. And there are millions more that aren't even diagnosable. So by the time somebody's diagnosed with an autoimmune disease, research estimates that it's about 4 to 10 years prior to that diagnosis when things were brewing on this inflammation spectrum. So I think all the things that you're teaching people about through your platform and through your products is really important, because what can we do today to start to move the needle in a positive direction? And there's so much we can do. I mean, we know so much more about inflammation than we knew 20 years ago. So but we have to know what we're dealing with to do something about it. And we have to do something different to see something different. And hopefully that we can talk about that today.
Yes. Also, what is the correlation between, do you want to explain the correlation between inflammation and autoimmune disease? How do people know they have whether the other or the one or the other? And, what are the symptoms? And because, there's a lot of silent inflammation we don't even see and know about. We know that there's inflammation when our knee is blown up or our skin is fire red and hurts. Then we see the inflammation, but mostly we don't even see inflammation. We all have inflammation in our system, which is also normal because it's an immune response, but we don't want the inflammation to, overpower our system, and we want to get inflammation under control. So how do we even verify? How can we see how strong the inflammation is in our body, and what can we do?
So you're right. Inflammation is not inherently bad. For people that are listening, inflammation is a part of our immune system. So it's about balance. It's homeostasis. It's the Goldilocks principle, right? The fairy tale Goldilocks, not too high, not too low, but just right. Inflammation, you want inflammation to come up to fight off viruses and kill off bacteria, but you don't want chronic inflammation. That is that forest fire that's burning in perpetuity. That's the issue. It's the breaking of that Goldilocks principle. So for people to really realize, it is quite a nebulous term of what the heck inflammation is, but for people to realize that things like fatigue, things even like a light background anxiety, a sense of anxiousness, mild depression, brain fog, trouble losing weight, digestive problems, these are all signs that the body has some level of chronic inflammation, not normal inflammation.
So everything basically, what kind of makes you feel out of balance. So you don't really know where it comes from, that it's worth looking into your inflammation level, right?
Absolutely. And we have quizzes and assessments on our website at drwilkel.com if people want to get a general idea of where they're at on the inflammation spectrum. But it's questions that I adapted from questions I ask patients is really what the quiz is. So they can find that out subjectively, but objectively, labs are really important too. If people do feel like intuitively there's something going on, most of the labs you can have run, the basic ones, you can get from any GP, any primary care physician. So high sensitivity C-reactive protein, or HSCRP, we want that to be under 1 in functional medicine. That's the optimal range. Higher levels are a sign that there's chronic inflammation or acute inflammation levels in the body. And homocysteine is another one. Homocysteine is an inflammatory marker. We want that to be under 7. So those are 2 really basic labs. You can have any conventional doctor run them to get some lab data to see your inflammation baseline.
Yeah. Yeah, and this, as soon as you have over a CRP over 1, you really need to keep looking. What is it? Where does it come from? You really need to get to the bottom of the problem, because you don't want to have that for like a longer time, and there are autoimmune diseases like rheumatoid arthritis, for example, which have like a constantly high inflammation level, which is not good. So, we're trying to get this down, whether, with the conventional medicine, mostly with medication, which are not so great for your system, but, there are also alternatives to, treating that. But let's talk about autoimmune disease again. What do you see mostly, and what is the why do you think it's rising, and what are the main problems?
Sure. I think that's a really good point to differentiate here, is that all autoimmune conditions are inflammatory, but not all inflammatory problems are autoimmune. So there's 2 different things, and sometimes they're conflated and we use them interchangeably, but it's important to have the distinction between the 2, because many more people have chronic inflammation than have autoimmunity. But there's a growing amount of people with autoimmunity, like I mentioned too. So there are about 100 known autoimmune conditions today that modern medicine recognizes as autoimmune. But then there's 40 diseases above that 100 that have autoimmune components, meaning that certain aspects of them looks to be autoimmune. And I have no doubt, as time goes on and we understand how more and more diseases operate, we're going to find autoimmune components to a lot of things that we don't even consider autoimmune today. But its definition is autoimmune. When you look at that word breakdown, it's when the immune system turns against itself. So you have what's called a phenomenon known as molecular mimicry. It's sort of the case of mistaken identity, when the immune system actually thinks that parts of the body is a virus or pathogen and attacks it. So that's a very specific type of inflammatory attack. So it's very localized against a certain area. But with somebody with one autoimmune condition, they're at an increased likelihood of other autoimmune issues, something called polyautoimmunity. But the most common ones are, the most common one is Hashimoto's disease, autoimmune thyroid problems, which you and I see all the time clinically. It's so common. It's when the immune system's attacking the thyroid, and you have to run thyroid antibodies to see if it's a true autoimmune thyroid issue. So that's the most common. Lupus is another common one. Sjogren's is pretty common. You mentioned rheumatoid arthritis. That is very common. Ulcerative colitis and Crohn's, two inflammatory GI issues, are very common. And alopecia with hair. Those are some common ones that we see.
I think, when it comes to an autoimmune disease, mostly also starts when people don't pay attention to symptoms. So I think if we keep going, and we really run ourselves down with stress and with, bad diet and, stress and on your work and whatever it is, I think if you really don't listen to your body early enough, you can run into this autoimmune problem, and then it's hard to get out of again. And I think that is where you come into place, where people, you really have to listen to yourself and to your body and be really, really specific. And, because, when it starts, there's things you can do. You can change your diet, you can change your habits, you can change your sleep habits, you can change a few things, adjust in your lifestyle and get out of it. It's, I think that is really important to really listen to your body. And the same with the skin. Someone just asked about dermatitis, I saw in the chat. And same with the skin. You can regulate your body response by your own lifestyle. And to me personally, when you have dermatitis, for example, or eczema, or any underlying skin condition, sometimes it's not better to run to the doctor and get like antibiotics or cortisone or whatever, but take a step back and look at it and really go with important ingredients, beautiful and soothing ingredients from the nature. Really adjust your skincare routine, but also your personal lifestyle. And there are ways we can handle it,
Yeah, absolutely. And I think no matter where people are at on that inflammation spectrum, you mentioned, I think it's a really good point that you brought up, is you mentioned the silent issues. Like that is one end of that inflammation spectrum. It's silent inflammation, meaning they don't notice it. If you ran labs, you would probably catch it on a lab, but they feel fine. And then there's the inflammation reactivity where many people are at, where they know something intuitively isn't right for them, but they don't really have any answers. And hopefully they're getting some answers through this conversation. And then there's the diagnosable people on the other end, where it's bad enough to be labeled with a diagnosis code. But again, that didn't happen overnight. And you're right. While these are sobering statistics, the good news is that we know so much more, and we have so many amazing tools that our parents' generation or grandparents' generation didn't know.
Let's talk about that, because we want to bring some knowledge to everybody, so we don't even get into the danger of causing a lot of inflammation. So what I've been talking about this like years and years, but what in your mind and your point are the biggest causes of inflammation, and what can we do in our lifestyle?
So I think the core four are the four foods that are most likely to drive inflammation levels up and disrupt the microbiome. So people, most of your tribe knows this, but it's 75% of the immune system. It's the trillions of bacteria in your gut. So to deal with inflammation, which is a product of the immune system, you have to look at where the predominance of the immune system resides. So to look in your gut, disruptors of the microbiome is a really important thing. But as you also teach that, I want people to realize that all the trillions of bacteria in your gut, we also have a skin microbiome. So they're interconnected. So you need a healthy gut microbiome, but a healthy skin microbiome. So the products that you're putting out there are so important because our skin is absorbing these things. It's really important, but they're not disrupting the skin microbiome. But going back to foods real fast, is the grains, predominantly gluten-containing grains, and you can have a nuanced position. I mean, obviously, if someone's in Europe, the grain supply is completely different than the grains here in the States, because they're hybridized and genetically modified, different grains, and they're sprayed with glyphosate and things like this. So there's definitely better grain options for people. But people that are living in the United States,
I just wanted to say, I think since I'm European and I also live a lot in the US, I see the differences in the food. I have way more trouble in the US finding really good food, and pure. And I feel like
Mhm.
there's so many more problems coming from food
Yeah.
here than it is in Europe.
Yeah, I mean, it's so true. I mean, we see patients that they cannot have grains in the United States. They'll go on vacation, they're fine.
Yeah.
Even severe people with celiac, and there's this larger celiac spectrum too. Celiac is just 1% of the population, but there are millions more that are having reactions to these foods that aren't
I
celiac.
just wanted to say, not even, even if you're not diagnosed with celiac, you still can have a problem with gluten, and I think
Absolutely.
that the three biggest problems is really when it comes to your food is histamine, gluten, and lactose. And to just be sure, I mean, you can
Mhm.
test it out, etc., but to just be sure, maybe you just step away from those,
Mhm.
in general.
Yeah, I agree with you fully. So definitely grains, added sugar is definitely a disruptor of the microbiome. And that's even in the nice sounding euphemisms. People need to read labels because sugar is hidden with many different nice sounding names,
As a
right?
consumer, I mean, as a consumer, we really need to read labels, and
Mhm.
it's mandatory. You need to educate yourself on what's in your products. That is regarding food, this is regarding skincare, this is regarding everything. We cannot trust anyone,
Yeah.
unfortunately. I think the
Mhm.
regulation, or you follow the brands you trust. But I totally agree, we need to really take charge ourselves. That's why, every visit at your doctor, you need to question, what did this doctor just say? Maybe you do a little research yourself. You need to
Mhm.
become your own expert. It's really, this is really asked from us.
Yeah, absolutely. And we want people to be informed and have agency over their health. It's their body, and they have a right to ask questions about things that are going on with their body. So sugar, definitely that. Industrial seed oils is another one where a lot of vegetable oil, canola oil, soybean oil, these are high on omega-6, which naturally in omega-6 is great, but in these more processed oils can be inflammatory, especially in higher amounts. They're in a lot of packaged foods. If people read the labels, they'll see these industrial seed oils in. And then the fourth would be dairy. And you could have a nuanced conversation on that too. In Europe, it's better. If it's grass-fed, it's better. But it's definitely problematic as well.
I think in general we can say anti-inflammatory food is mostly plant-based diet, and then Harvard studies say also particularly food was particularly great for anti-inflammation, like cherries, oranges, green leaf vegetable, olives,
Mhm.
salmon, mackerel, almond, walnuts. And
Mhm.
what causes a lot of inflammation is fried food, sugar, processed meat, sodas, all this kind of stuff.
Mhm.
We better stay away. And then the things we just said, gluten, lactose, um, and also maybe histamine for a few of us. And I think also what matters is the idea how we eat, because we start in our mouth with the saliva, and it goes through our esophagus, it goes in our stomach, and then goes in our gut with all the bacteria. So there's like a system. We process the food in our bodies,
Mhm.
and if we don't chew enough, that already causes problems to us. So
Yeah.
ideally we chew like 40 times every bite. I know it's like it sounds crazy, but it really helps the digestive system. And another thing, lots of people try to be vegan, and vegan mostly is raw food, and raw food is quite aggressive to our
Mhm.
stomach because it's hard to digest, and especially if you don't chew the carrots correctly, you get like these big chunks of carrots which are hard to digest. People get real stomach problems from it.
Mhm.
And especially if you eat late at night, so salads at night, for example, yeah, raw food at night sits in your stomach and it's hard to digest, and all of a sudden it becomes acidic, and the acidity, Charlie, and the acidity causes inflammation. Yeah.
Mhm.
So this is another point, not
Yeah.
just what we eat, but also when and how we eat it.
Yeah. How you're preparing it. You're right. I see that a lot where people they think they're doing the right thing, but maybe their gut isn't as healthy. A lot of people have these gut problems and they don't even really know it. So they're trying to do the right thing and they're eating a lot of salads, a lot of raw vegetables. Would be fine if you had great gut health. But a lot of people are getting bloated and stomach pain just from salads. It doesn't mean
Yeah.
the salad is the problem so much, but you need to meet your gut where it's at. And sometimes having more soups and stews and cooked vegetables,
Right, cooked food, yeah,
really helpful.
would heal it. We
Yeah.
did a cleanse just before Christmas where we only ate, slow cooked vegetable, and it helped us so much. And in the morning we ate, a porridge made with oat milk, and then just like cooked vegetable, maybe a little piece of fish with it, or a little piece of chicken, but no fruit, no raw food, no grains, really pure, and that really translated into absolute well-being in your gut, because stress can reflect in your system, in your gut, and you get like stomach pain, and I think lots of us experience this correlation between our mental health and gut and sleep deprivation. So I think healing your gut already helps with so many other things besides really lowering your inflammation. It's easy to do. You can do this at home. It's it's not a big task to cook your vegetable or make a porridge, so it's really easy to maintain.
Yeah, people can get those Instapots and make soups and stews. It's people should do that, more of that stuff. With traditionally, a lot of societies would have done that, but we've gotten away from those more traditional soft cooked soups and stews, which are really helpful. Another thing I'm really fascinated about, and I'm curious to know what you think about it, but I wrote about it. That's actually the title of my first book, came out a couple of years ago. It's called Ketotarian. It's the idea and the science around how can we get the best of being plant-based and the best of being keto adapted. So a mostly plant-based ketogenic diet, or ketotarian. I am fascinated around the research of what at least times of ketosis would do to lower inflammation levels, but doing it in a clean plant-based way. Because beta hydroxybutyrate, this ketone that our body produces, it's an anti-inflammatory. So it lowers these NF-kappa B pathways and these NLRP3 inflammasomes, these things that are high in a lot of people with inflammation. It lowers it naturally. But I recommend a cyclical ketotarian approach.
I think you need to do it very balanced and most people, they jump on it too hard and too crazy, and then it goes into the exact opposite in my eyes. I think it needs to be really guided and plant-based, as you said. I think that I totally agree, but I always also recommend like a very balanced diet, not too much of this, not too much of that. I always believe that extremist, extreme things don't really help so much as well. But guided, I totally agree.
Yeah, I like a cyclical approach, especially when it's clean. Women can increase their clean carbohydrates, like you mentioned, the porridge or fruits or rice or quinoa or sweet potatoes around their cycle. I find many women do better around their periods and around ovulation. They need more clean carbohydrates. So you're right.
That's great. Let's talk about clean carbohydrates. I think that's something everybody's super interested in. These are the carbohydrates we can go for. Rice, probably mostly brown rice, quinoa,
sweet potatoes,
oats, sweet potatoes.
Yeah, even regular potatoes are fine for people. Sometimes,
and then I mean, like if you like pasta, there are lots of really good pasta made.
Pastas.
Yes, I think there are some.
Yeah, chickpea pasta, and there's almond
flour. And you know what? This is only guidance. It doesn't mean that you need to never go to an Italian restaurant anymore. It's just like your basics.
Suggestions.
Yes, and then we all like to indulge in some great desserts, whatever. But like a basic guidance, I think.
Right.
Medicine. You know what? You just talked about the microbiome in the skin, and this is something I really much appreciate you talking about it. And microbiome, we carry 2 kilogram microbiome with us, and these are like bacteria, viruses, parasites, fungus. This is all like good stuff on us. It's good that it's on our skin, but it needs to be in a balance. And that's why I just said, if we use antibiotic cream or hydrocortisone or cortisone creams, it basically destructs your microbiome on the skin, and then it damages your skin barrier function, and then you get all these problems, sensitivity, dryness on our skin. So sometimes it's good, even if we have a skin problem, to think, what can I do what's good for my skin right now, and not just like bombard the skin with medication or harsh ingredients. And that's why it's also so important to really see what's in our skincare products. If it's acids, stay away. If it's retin-A, stay away. If it's high dosage vitamin C, stay away. If it's glycolic hydroquinone, stay away. If it's laser treatment, stay away. If it's fragrances and skincare, stay away from it, just because it destructs your microbiome and it causes inflammation. And that's why I'm so, I don't want to tell you what to do, what not to do. I just want to give you the tools to verify, if I do this right now, these are the causes, and then this can happen. So it's mostly just to, we want to keep our skin healthy as we keep our body and our system healthy. And if we have healthy skin, our skin also looks great. Healthy skin and a healthy body. And we know a lot about the history of medicine as well. So when doctors only had your skin and your eyes and your tongue and your appearance to really verify, are you sick or are you healthy? So skin tells us a lot about if you're healthy. And if you bombard your skin with aggressors, then you cause a lot of inflammation here already. And we also have to always keep in mind, what we put on our skin most likely can also penetrate the skin and really get into our system, which also can be quite dangerous. That's why lots of, skincare also suggests don't use it when you're pregnant.
Yeah, and it's that, going back to that principle that I mentioned earlier, of that Goldilocks principle. You want it to be effective, like you did with the Good C, I think is a good example of that, is that these things are good, but it's about the right dosage, the right impact of it. Not more isn't always better. And that's the breaking of that Goldilocks principle that I think is important.
The Good C idea, no? Just because we're talking about, because there's so many vitamin C serums which have so much, of the vitamin C, which just bombards the skin, and it's not stable for a long time anyway, but you just bring it on the skin, not in a form where it can penetrate the skin, but just bombards the skin. And, I think there's not enough thought going into it. It's just like, okay, vitamin C is great. Let's put a big vitamin C serum. It's like, let's think, what does the skin need and which form does the skin need vitamin C? Does it penetrate? What does it do on our skin? What are the strengths of vitamin C? How can we support the effect of the vitamin C? So we created this unicorn of 3 forms of vitamin C, which actually one of them is soluble in fat and is encapsulated and gets transported into the skin, and only opens the effect right there where it's needed, instead of being on the surface, destructing your skin barrier and really causing sensitivity. So most people don't even tolerate a vitamin C serum because of that. But the effects should be really in deeper layers anyway. And we have these 3 forms. One is from the kakadu plum from Australia, superfood, super good. It's 50 times higher concentrated in vitamin C than an orange. So vitamin C is amazing. It's amazing as a supplement. We should probably take 2 times 1,000 milligrams vitamin C orally every day. Really amazing for us. Also for the skin, when it comes to collagen production, to catching free radicals, to creating lipids in our skin barrier, all this kind of stuff. It's great. But if it really bombards our skin, it's more bad than it's great. So let's go with the things in balance, and what's good we keep, and what's not so good we should exclude.
No, I completely agree. It's just a measured approach, and people need to realize you want to be effective, but don't push beyond that. And our skin is our largest organ. For people to realize that is very important. We like to separate our skin from the rest of our health, but it's very much intertwined. And the research, even looking at the gut-skin axis, is really exciting to me too. Is like what goes on in the gut can impact the skin, and vice versa. This bi-directional relationship between our gut and our skin.
So how would you see if something is going on in the gut? How do you see it on the skin?
So it's both ways. So I think that I've heard it said, and I think it's a good way of putting it, is that our skin in some ways, and in many ways for people with different inflammatory problems, the skin is an outer representation of what's going on with the gut lining. So you need a bidirectional approach to really dealing with inflammatory skin problems, where really focusing on, as you advocate for, an anti-inflammatory lifestyle, that's dealing with the inside out, but then you have to deal with the outside in with these therapeutics and these products that are really supportive of nourishing the skin and hydrating the skin and rebalancing the skin microbiome, which is probably disrupted if it's going on. So you have to really heal the skin microbiome, and you have to really heal the gut microbiome for both sides of that coin to heal.
Amazing you say that. So respect your skin barriers, your microbiome, respect and love to all the functions of our skin brings us really to the point of good skin. And honestly, even if you have acne, rosacea, any kinds of symptom, eczema, whatever it is, treat your skin with love and respect. Then you will heal those problems, heal and repair. Don't attack skin which is already so destructed. Don't attack it more. Let's go the opposite way. Let's heal and repair. So, and I think now we have a couple of people who want to dial in with us and have a conversation with us, and I'm very excited to talk to the first one.
Yes, so Mackenzie is up first.
Mackenzie, hi.
Hi, can you hear me?
Hi,
yes,
Mackenzie.
hi.
Hi, so nice to meet you both. I'm Mackenzie. I'm currently located in Pennsylvania right now. One of the major questions that I have for you today is, what are some products and practices to use for dull skin? I feel like something I've been struggling with recently is feeling like I'm looking in the mirror and I kind of look either sick or a ghost. Like I feel like I look like I just saw a ghost, and I just look so like the life got sucked out of me. And I've been I just feel like I haven't really found a product that's actually worked for me. And I don't want to keep using, like glow drops and things to try to like brighten up my skin because they might be clogging my pores. So yeah, that is my question for you today.
Okay, that's a really good question for both of us. First of all, I think we all suffer, just being at home. Being at home the whole time, it's kind of, hard for our mental health, because we need to normally would get out and meet people, which is kind of a problem right now. We should get out and get fresh air. We, have sleep deprivation because, we get anxiety about what's going on. I think there's a lot of uncertainty, and it really has an impact on our overall health. So I don't think it's just skin related, the dullness and the, I think it's also stress related, and cortisol is one of, our stress hormones, which can also relate to inflammation, can be seen on our skin. So number one, I think this is one of the explanation where we can try to help a little bit with a bunch of things. But when it comes to skin, I agree, you don't want to just, put something on for an instant effect. You want to have something which really brings the best out of your skin. And I don't know how your skin routine looks right now, but my recommendation is to really help your skin and get a healthy skin. Use a cleanser every night to cleanse your skin. Use the Enzyme Cleanser. This is our powder you mix with water for a healthy and gentle exfoliation twice a week. To get the dead skin cells off, because then you can prevent clogged pores, but also you can make sure active ingredients and hydration goes into your skin. So twice a week, use the Enzyme Cleanser, and then use a hyaluronic serum and a face cream. And if you want, you can add a step with a balancing toner to really help with your pH, but also with your microbiome. You can do this before your skincare steps, but have a hyaluronic serum. This could be your anti-pollution drops, for example, to also give you extra benefits for sitting in front of the computer. This is another culprit for damaging your skin. If you spend a lot of times on the screen, maybe you want to get the anti-pollution drops to not just hydrate, but also protect from the HEV light coming from the phones. And then a great moisturizer, face cream, to keep it really simple but yet super effective. And this will give you healthy, glowy skin and not dull, and will help you definitely with your appearance, with your skin. And Will, you probably want to say something to the overall health and what to do in these times, especially from the inside out?
Sure. Yeah, to echo everything that Dr. Sturm said, I obviously agree with, and you don't need me to tell you this because you had Dr. Sturm telling you this, but specifically what's made a big change in my patients' lives and my own as well is the Enzyme Cleanser. And honestly, I've started it a couple of days ago, last week, actually, I started taking the Good to See. I got it shipped to me. Thank you so much for that, Barbara. And I've noticed a big difference in that too. So if you're looking at all the products that she said, but specifically the Enzyme Cleanser is a game changer for me and my patients, and the Good C, it helps with radiance. But to Barbara's point, I think that getting outside is very important. And I'm in Pennsylvania too, so I know we have these gloomy days. I'm in Pittsburgh. So I, without a doubt, get outside as much as you can. It's sunny today, at least where I'm at.
It is sunny today.
So
yeah.
get outside. And also I would say too, if it is gloomy more or cold, or you can't get outside for whatever reason, try red light therapy. If you've ever heard of the Juve light.
Yes, I have actually.
Okay. So
Yeah.
maybe consider that, because I think if you live in a cloudier, colder climate, or because of COVID, you can't get out as much, I would say get some light therapy in your house and use that, which there's completely safe to do. And it really helps with circulation and some sweating, all good things to really bring your skin to life.
Okay, that is so great. Thank you both so much for this advice. I've
You're
been
welcome.
trying to figure out this problem for so long now, and this is probably the best people that I'm going to get this advice from. So thank you guys so much.
Oh,
Yeah.
good luck, and stay safe, stay
Thank you,
healthy,
you
and
too.
stay happy. It's, sometimes also good to just stay optimistic. It's sometimes hard, but
Yeah,
we just got to.
I know.
We just got to.
Thank you both so much.
Thank you.
Bye, Mackenzie. Nice to
Bye.
meet you.
Nice to meet you.
So we have Alexa next.
Alexa. Hi, Alexa.
Hi, can you hear me?
Yes. How are you?
Hi. Good, how are you? Nice to meet both of you.
Meet you.
Nice to meet you.
So my name is Alexa. I currently live in Florida, South Florida, but I'm not from here. My family's from Pittsburgh, Dr. Cole, and I grew up in Maryland a little bit too. But I've been in Florida for a few years, so definitely in that sun and heat, and tried to protect my skin as much as possible. But I started experiencing melasma about 5 years ago, and off and on with gut issues as well. And I'm a holistic health coach, so I've done tons of research. Dr. Cole, I have your book, The Inflammation Diet, or Spectrum. So I've done a lot of research on how to approach it internally and externally. And I've worked with a functional medicine doctor before and have done tons of tests. I've tried many different products, and natural and some with chemicals, unfortunately. So to this day, it's gotten worse and worse. And I am just trying to figure out, and I would love to hear both your perspective on maybe next steps on how to heal it, because I feel like I'm at a loss, and I've tried everything and I don't know what to do next. So that's kind of where I'm at.
Wow, that is super, super interesting that, first of all, you're educated in this area and you tried everything. And yeah, there's a lot of promises out there, especially on the chemical side, taking off your healthy skin layers and basically trying to take it off your skin this way. But, this way you make your skin super vulnerable and, allow stressors to come into your skin. And even if you put sunscreen on, what about the HUV light from the phones causing pigmentation issues? So I always recommend completely against all chemical peels and retin-A and everything which resurfaces your skin. So I created a combination. I created some products and taken in the right combination. We had some amazing successes. So, and I tell you the story quickly because it was so interesting. This summer, one of my friends who was using the products, she always was having melasma, and she was using my products, was happy with her skin, but her melasma wasn't really doing anything. And I saw her with makeup on the summer, and she said, it's so bad and I don't know what to do. And I sat down with her and I said, okay, these are the steps you're taking the products now. And I want you to really follow the routine morning and night. She did that after 3 weeks. I mean, it was almost everything gone. I couldn't believe it. She was not wearing makeup. I forgot about it, but we did like a before and after on our Instagram. So if you want to scroll back and find her, but that was really amazing. So we have this combination of products we put together, and I will give you exactly the combination, and our team will also write it to you, because we created the darker skin tone line together, are really amazing. It's only with ingredients which help to even out the skin tone, like Lumicol, for example, and the brightening line, we use something like watercress sprouts and other ingredients like olive leaf extract and garden cress, to really loosen the agglomeration of the yellow and dark spots, the melanin formation, which took place or takes place when we experience hyperpigmentation. And that can also be a form of post-inflammation. So if you had an inflammation, and some people just get a scratch or squeeze a pimple or get an injection or whatever, and then go in the sun burns through and it causes hyperpigmentation, which is called post-inflammatory hyperpigmentation. And the darker your skin tone is, the more you suffer of this post-inflammatory hyperpigmentation. So what we recommend is doing the cleanser and enzyme cleanser from the darker skin tone line. So use the darker skin tone line, also the hyaluronic serum from the darker skin tone line. So you get the benefits of the ingredients there to even out the skin tone. Then we recommend the brightening serum. So that's the brightening serum, and the brightening face cream. And then last but not least, use the sun drops. Yeah, the sun drops. And the sun drops is SPF 50. And one of the supplements I want to recommend you, which makes a huge difference, really interesting, is the Brightening Food. And these ingredients really help also to help from internal. It has like copper, olive leaf extract, also garden cress, and ingredients coming from the nature. So nothing is aggressive, nothing will damage your skin, nothing will do any harm to your skin, but just the opposite. Heal and love and repair your skin and take inflammation out of the skin and help to loosen what's already there. And one really great serum to add to your routine now is also the Good C, because vitamin C is also known to downregulate tyrosinase, and tyrosinase is the enzyme which is responsible for the melanin formation causes of hyperpigmentation. So vitamin C
She froze here.
and that is one thing I want to tell you all, because aggressive is to attack skin, to kind of brighten your skin. But actually what vitamin C really does is taking away free radicals, taking away, helping with collagen production, and also with brightening, of course, but also mainly to prevent from the hyperpigmentation appearances. So you want to do the solution of those pigmentation and take it away. That's what you do with the brightening line. The darker skin tone line evens out your skin tone, and the Good C prevents from further pigmentation. Yeah.
Yeah. Yeah, thank you. I've tried a couple of your products before, but not like a whole series. So maybe it's the right combo, but I have used vitamin C. I've used all kinds of things that just didn't seem to make a difference, which is why I thought maybe there's a whole internal element of inflammation going on as well.
Yeah, and stay with one routine. You know, I think most of the people try to curate their own skincare routine. So you do the cleanser from this brand and the serum from that brand and the cream from that. Looks great in the bathroom, but it doesn't make any sense. So the best really is to decide for one line and really use it together, because, you know, me as a doctor, I really think about the effect, you know, the effects of all my ingredients and how they play and interact with each other. And that is really the main essence. No drops from Sturm, but I do all the other stuff from, you know, and you then it's no surprise that you don't get to the right hydration level, to the right anti-inflammatory level. Everything you want, everything I stand for and my philosophy really speaks for all, using all the products together. Yeah. and not all. You can have 2 or 3 products of my line, but stick to those and not mix with others. You know, it doesn't have to be like a 10-step routine. You know, now with melasma, we have a little more elaborate routine because we target, you know, a specific skin problem here. Yeah. I don't know. Will, do you want to add something?
Yeah, that's definitely an effective protocol. So I would definitely advocate that from the outside in, and the supplement as well. Another thing to think about is you mentioned working with a functional medicine doctor. I obviously I don't know your labs, but I would advocate, if you haven't had this running a full hormonal panel, like a Dutch test, urine saliva test, and then a full microbiome panel. I'm assuming you probably had something like that ran, but the lab is not the answer. The lab is just the direction for the answer. So in addition to dealing with the products that Dr. Sturm mentioned, I think really looking at the hormonal components and the gut components and really supporting your hormones and gut in a way that's effective. It's one thing to run these labs and like just throw some things at it, but you have to really be diligent and then retest to see if what you're doing is actually working. So that would be maybe the due diligence that I think your case requires. If you're already a health coach and you're already seeing a functional medicine doctor, to maybe get some updated labs and maybe look for another functional medicine doctor. Also, the gut takes time to heal as well, and the hormones take time to heal. A nice gut skin axis protocol that I like for people is a GAPS approach. If you've not done a GAPS protocol, do that for a while. It's kind of like what Dr. Sturm did for herself with the broths and the soups and no fruits for a while, but do that for a longer period of time. So maybe consider a GAPS protocol and some labs in addition to the skin protocol, I think are 3 good things to consider.
For sure.
Amazing.
Yeah, thank you. I will definitely look into that. And because I've done like your anti-inflammatory, but I did for the core 8, I did a full month and that was it. So I was like, maybe that wasn't long enough.
Yeah.
I mean, overall, I've mostly eliminated the core 4. And I eat super clean, check all my ingredients, like super duper, like conscious of that. So I'm like, what am I missing? So yeah. I don't know if it's just putting all these pieces together and
oftentimes it is.
Time. Yeah.
Oftentimes it is. Yeah. So give it more time.
Like I was going to say, how long, like a minimum of 3 months, or like how long do you think to really give it to start?
Depends on the person, depends on their baseline when they're starting off. But like I mentioned in the book, 8 weeks is just scratching the surface for most people. So really reevaluate it after every month. But the gut can take, depending on their baseline, it can take 1.5 years to 2 years to really heal. So that's going to take time. So don't give up. 4 weeks isn't enough time for somebody, for most people. If you see it recover, then that's amazing. But most people, it's not going to achieve 100% in 4 weeks.
Right. Okay.
Awesome. Thanks so much.
Thank you guys so much. I appreciate it.
Thank you.
Stay safe, stay healthy.
Thank you. Yeah.
So next we have Theodora.
Hi, Theodora.
Hi, hello.
Hi.
Do you hear me? Yeah.
Yeah.
I'm calling from the Netherlands. I'm very happy to see you both. I was very interested by to hear the topic of this recurrence of the skin school. So my question goes a bit more towards the beginning of the of the hour when you actually talked about autoimmune diseases. And I was curious to understand how much genetics is in that area, because, for example, my father indeed is diagnosed with rheumatoid arthritis. So I'm thinking, how much can this influence my life, and if there are any tests that I can take, I don't know, a bit earlier in my life to avoid this, because I think also my grandma has something similar. So I think it's also one of the areas of medicine that is a bit not neglected, but it's not in the face. So nothing breaks initially. And then I think it just gets there towards later in life, I think. So maybe you can have a bit of help on that. Of course, not to mention, yeah.
It's a very interesting question. And it's really important to also look what your family, what kind of disease, have been in your family, because that, of course, rheumatoid arthritis is hereditary. So,
Okay.
it doesn't mean that you get it just because your your father had it, your grandma. But it makes sense and be proactive here. And I don't know if Will agrees to that, but my idea would be check your rheumatoid factors, check your HLA-B27, check your CRP, check a few things in the lab, which could already, tell you if you are predispositioned to possibly have a problem later. And especially for you, it's great to go on an anti-inflammatory lifestyle completely, because even if you would be predispositioned, you can help yourself already with really getting your inflammation levels lower. Well, what are your thoughts on that?
So definitely research estimates for most people with autoimmunity, a third of that autoimmune puzzle is genetics. So that is a component for most people, but 2/3 is epigenetics. So it's this lifestyle. The majority of it is lifestyle that can trigger that genetic predisposition. So these are typically X chromosome linked, meaning more women sadly have autoimmune conditions over men. And if it's coming from your dad's side, he only has one X chromosome to give. So statistically, if it's coming from the dad's side, it is more likely that the daughter would have some type of autoimmune issue. It doesn't mean she's going to, it just means the likelihood is there. But like these conversations are so important for someone in your position where you can start now, wherever you're at, to start to mitigate these risk factors as much as you can. And there's so much influence that you wield over your inflammation levels, over your biochemistry through implementing these practices and tools that we're talking about. And to answer your lab question, yes, there is. The labs that Barbara mentioned, but also there is a more out of the box lab. It's from a lab in the United States called Cyrex. We can coordinate it for you in the Netherlands, and we would just have it drop shipped here. But it is predictive autoimmunity, or what they call multiple autoimmune reactivity screen. So it's measuring antibodies against certain parts of the body. So if you wanted to see if you had autoimmune components, that is one.
Yeah, you should definitely do that. Definitely.
Yeah. That's why the question, because sometimes in Europe, I think some of the, especially now during Corona, everyone is like focused on a different direction, and I have a different approach. I'm not sick of anything else, and usually my family was fine. But this is something that I don't want to ignore, because I can see how much my father struggles. And every time I go, it's like, oh, but it's not really, doctors are very nice. That's also true here, but the priorities are also different, and it's more like there's always something else. So I'm thinking, there's nothing urgent there, but I just don't want to ignore it. And I thought today's and your perspective is, I absolutely admire a lot what you do. So I kind of trust your advice.
Yeah, you should definitely do a consultation with Dr. Cole here and do the lab work, definitely. And get on an anti-inflammatory lifestyle, what you're probably already doing, but really also cut out red meat and really try to keep your inflammation base very, very low.
I mean, for 2 months, I'm all completely on your product, and that's another story that I'm absolutely
amazing. Yeah, your skin looks great, by the way.
But my skin is absolutely like it was 20 years ago, maybe. I don't know.
That's
it's really
awesome.
amazing.
It looks great.
Yeah, honestly, it's fantastic. I know I'm a bit, the light is not the best, but they're beyond
You're happy.
expectations. Yeah, fantastic. So congratulations for this. Thank you for your answer. I don't want to take more time, but I'll probably get in touch to get a bit more maybe advice and with Dr. Will. So thank you very much.
Always.
Thank you. Bye.
Bye to Netherlands.